You're watching a special edition of Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. On this show, we take a very special look at TMJ, or TMD, the dysfunction of the jaw joint, and sleeping disorders, including sleep apnea, that adversely affect the quality of life for millions of people, with one of the leading providers of cutting-edge treatment available. So if you have headaches, neck or shoulder pain, jaw pain, snore, toss and turn at night, are fatigued, or maybe know someone who is, then stick around. You're about to hear some life-changing information. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're very pleased to have in studio Dr. Roy Jolley. Dr. Jolley is a fellow of the American Academy of Craniofacial Pain, a small and select group of dental professionals specializing in the treatment of TMJ and sleep disorders, and is considered by most to be one of the premier comprehensive care providers available today. Dr. Jolley's general dentistry practice in Little Rock is recognized by patients and peers alike as a cutting-edge treatment and care facility for the cure of TMJ and sleep disorder problems. Dr. Jolley, welcome to the show.
Thank you, Mike. It's a privilege to be here. Thank you for having me on the show.
Okay, I came out now. I did a little background, as I do with everybody. I came out to your practice before having you on, and I can't help but notice that your practice is more of a spa-like setting. It's almost like being in a tree house. Well, we're going to go through some pictures, but tell me a little bit about the development of your practice.
Well, Mike, the number one reason people don't come to a dental office is fear. So we've tried to create in our office a fearless type of environment, and as you said, a spa type environment. That's exactly what we've tried to create. Now, you'll see this is a picture of my office. It's in the woods, sits back in a natural setting. There's an inside, this is our reception area. It's clean, crisp. When you walk in, it doesn't smell like a dental office. It smells of aromatherapy. Smells like more of a massage spa than it does a dental office.
Well, your waiting room had the plants. I mean, again, the big windows that were open. This is just down a hallway.
Shot down the hall.
Again, much more of spa-like feeling. I took this picture. This is what I call behind the office. When you go into the back office, normally you see the charts and the clutter and it's very clean. But if we look in that operatory, you kind of see a little bit of foliage through the window there. And I took this next picture because every operatory you have has a window just like this. The whole wall's glass looking out into beautiful greenery. And I mean all of them. Normal dentist office, you have the wall and you have, normally some Venetian blinds with a little dust on them.
Well, this is no accident. Our office was designed to create a warm environment, again, addressing the fear issue, trying to create a really unique experience when you come to my dental office.
Okay, now, speaking of unique, who is this cast of characters?
This is my staff, who I might say is the best staff in the world. I could not practice the type of dentistry I practice without this professional staff. Every one of them are just top-notch, excellent clinicians.
Okay, let's get into what is TMJ or TMD, how do you treat it, and how does your treatment differ? First of all, give me a little explanation using the photos about what is it actually.
Well, the TMJ joint is the jaw joint. If this is the mandible, and these are the condyles. You with me? This is the condyles. And here's a picture of a condyle with a disc on top, the blue disc. That's a normal relationship. Behind the disc, you see these normal tight ligaments that control the disc as the jaw opens and closes, as the red muscle pulls the jaw forward and the disc forward, the ligaments pull the disc back. Now, if you'll go to the next slide, you'll see here's an example of a patient who is either grinding their teeth, a whiplash injury, possible bicuspid extraction, where the condyle now is up and back. So the disc is pushed forward. Notice that the disc is now red, indicating inflammation. Those normal ligaments are now stretched. Go back to the first picture, Mike.
Okay.
Now, if you'll notice the normal tight look at the difference in these ligaments, and go to the second slide. And see how these are stretched? Now when the jaw opens, it pops onto the disc, and then when it closes, it pops off the disc and presses on these ligaments, which also is the same area where there's nerves and blood vessels.
And then over time, does that just continue to get worse?
Yes. If you don't hear anything else I say, in fact, we're about to see a movie about this. Temporomandibular disease is always progressive. If you have a clicking joint, that joint in time, given enough time, will break down. So if you can...
Let's go to look at the thing. I want to talk to you, though. You made a comment to me about TMD or TMJ being the great imposter.
The great imposter.
Meaning most people would think you would feel the pain here in your jaw joint, but the pain's felt throughout the body.
The most common symptom of temporomandibular disease is headache. Now you would think if I have a jaw joint problem, the primary point of pain would be in the joint, but that's not true in the TMJ. Headache is the #1 symptom. Chronic neck pain, shoulder pain is the second most common symptom. The third most common symptom is popping, clicking, or pain in the joint. And then you get into ringing in the ears, a stuffiness, into loss of hearing, a dizziness, kind of a vertigo
All
feeling.
from the jaw joint.
All because the condyle is sitting right in front of the ear canal, so you have ear symptoms. But it's important to know that are we looking at this picture?
Yes, we can look at this.
Behind this yellow area that you see looks like a fat pad, but what actually is there are nerves and blood vessels, some of the major arteries and veins of the body. The jugular vein, the carotid artery, the trigeminal nerve, the auriculotemporal
all run
nerve,
through there.
all run right through this.
Okay.
So when this condyle backs up, it presses on those nerves, and that produces the symptoms throughout the body. For example, if you hurt your neck and your fingers get numb,
Oh, no.
a good example, you pinch the nerve here, but the pain is in the fingers.
All
Same
right.
thing in the TMJ joint. If you press these nerves, you can have symptoms almost anywhere in the body.
And this is
that's
a normal...
the reason it's called the great imposter.
So you can feel it anywhere. But
That's exactly right.
And this is a normal, we're going to get into that because I interviewed a lot of your patients, and most of them had seen a multitude of other doctors before getting to you. So this is what a properly set joint would look
Right.
like.
The orange is the disc. The
Okay.
yellow are the nerves and the blood vessels. This first line is the condyle, and the second line is the fossa.
Okay.
Now, if you show normal opening, as the condyle slides forward, it rides on the orange disc. That's
Right.
perfectly normal. And then you start grinding your teeth,
Okay.
or have some trauma. The disc moves forward, still within normal limits. And then this gets a little bit worse. The disc continues to move forward. Now you notice we've created a pop. There's a pop in the joint as you
Right.
open and a pop when you close. And if you continue, it gets a little bit worse. Can you make that go forward?
Yeah, let's go right here. Oops, I'm a little farther. Sorry about that, Doc.
Well, you're
All right, go
all
ahead.
the way forward now. Now when the patient tries to open, they have a restricted opening. And many patients out there watching this will say, you know, my mouth doesn't open fully anymore. And they're in stage 3 of temporomandibular disease.
What happens after stage 3?
Well, what we don't want to happen is for this condyle to perforate the disc, and now we're bone on bone, which is osteoarthritis.
And in most cases, you said the bone has a tendency to rest on the backbone, compressing all those veins and nerves, which is why we feel it throughout our body. All right, when I came to your office, and again, we're running out of time, we have to take a break, but I have an interview I want to look at because I asked you about age of the patients. And you had a patient there, I think she's 86 or 87. Let's take a look at her interview.
Our dentist at home pulled a wisdom tooth, and here I am, 86 years old, a year ago last October, and it started popping. My bones popped on my right side. He decided finally, I had headaches, earaches, backaches, and he finally decided to put another tooth back in that hole. And he left the tooth that was next to it and pulled the one on the other side to put a permanent bridge in. And when that all got in, my popping got worse, my headaches got worse, my neck hurt, had the earache. It was just bad. A friend of my daughter's had been coming to Dr. Jolley, and I had no idea who could treat TMJ. That's what my dentist told me I had. So she said, even if he can't help you, you'll enjoy talking to Dr. Jolley. He's so kind and so nice. Well, they are absolutely. I told him my second visit, I said, I have never seen such a wonderful group of young girls that are so friendly and so nice. And I told him that. They're precious. every one of them. I have no more headaches. I have no more earaches. The back of my neck that hurts so badly doesn't hurt at all. And I've had a pain in behind my bra for years and years. And I was told that I had a cushion out of my vertebrae. For the last 4 weeks, I haven't had a single pain back there. And I'm shocked. I just can't believe that these retainers, he doesn't call them retainers, I've forgotten what he calls them, but I can't believe that they're helping this problem. And I was 86 when this all happened. And now I'm 87, and I never dreamed that anything like this could happen.
Dr. Jolley, we have to take a quick break. When we come back, I want to talk a little bit more about her case. But before we go, I want to ask you, do you get personal satisfaction out of helping these people?
Absolutely.
You're watching Medical News Network. I'm Mike Wittgenstein. We're in studio with Dr. Jolley, and we'll be right back.
Someone they don't know a gift. They do it because this gift saves lives. And the need for it is desperate. We need over 20,000 people to give this precious gift every day. Please give blood. There's a life to be saved right now. Call the American Red Cross at 1-800-GIVE-LIFE.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Welcome back. We're in studio with Dr. Jolley talking about TMJ and sleep disorders. All right, Doc, before we went to the break, we ran the clip of Kay, 86, 87 years old, obviously someone who was at a point in their life that thought they might be beyond help or not be helpable. What is a typical TMJ patient like?
Typically, TMJ can affect young people. We see as many young people as we do elderly. In her case, she had multiple symptoms, headaches, neck aches, that spot in her back that she referred to, and just had learned to live with the pain and just had kind of given up on life. Well, you can imagine if that's happening when you're 25 years old and people think you're crazy because you have headaches all day and you can't find a reason. You've been to neurosurgeons, you've been to ear, nose, and throat.
We've got another clip that I'm going to show next, and this lady said that they even sent her to, well, let's listen to what she had to say, and then we'll talk about it.
6 years ago, I developed terrible, constant, debilitating headaches. I went to numerous doctors, pain management doctors, neurologists, dentists, orthodontists, just continuous. And they finally even sent me to a psychiatrist to see if they could get something to relieve the pain. Nothing worked. Called Dr. Jolley's office and talked to his staff at length and knew that I could tell that they knew what they were talking about as far as TMJ was concerned. So I thought, well, I'll make an appointment, go in, and just see if I think he can do this job. Talked to him, and within 3 visits, we totally had the headaches under control. It was a miracle to me. But, well, my symptoms were not what you normally have with TMJ. My jaw didn't lock. I could get my mouth all the way open. I didn't have any pain in my jaw. My head just hurt. But I could press on my cheeks and up with these muscles around my face, and I could trigger a headache. I went to numerous doctors, and the solution was just to give me more medicine. The appliance was a little hard to get used to, but it was not painful. None. Zero pain. No pain. Within 48 hours after I put it in my mouth, my headaches were gone. And if I take it out of my mouth, in an hour, my head hurts again. So I just don't go without it, and it's become part of my life, and it's not a big deal at all. I don't even notice it anymore. Oh, yes, I'm in a better mood. I'm much happier. They're wonderful. They are so nice and so down to earth and friendly. He is my hero. It's the best money I've ever spent in my life. I would do it in a heartbeat. I'd spend 3 times the amount of money. The beautiful thing is the appliance does not interfere with my daily life at all. It's wonderful.
All right, Dr. Jolley, I spoke to a ton of people when I was, and unfortunately we're not going to have time to see them all, but they all continued to repeat basically the same thing. She said she considered it a miracle, and they had actually sent her to a psychiatrist because they thought the pain was in her head. Is she a typical patient?
Well, there is really no typical patient. A patient, you can have TMD at any age. I wish I had a dime for every time a patient said to me, this is a miracle, because it doesn't make sense. You put a simple orthotic in the mouth and you get relief of all these different symptoms. She's been to a psychiatrist. We have women who come in and say, my husband thinks I'm crazy. I have these headaches and no one can find out why.
Does it normally affect just women?
No. Oh, absolutely not. We see as many men as we do. Well, actually, about 60% women, about 40% men, and don't ask me why.
Okay,
I don't know.
And I don't mean to cut you off, but we have to move along, and I want you make it sound simple with all you do is put a little orthotic. They all make it sound really simple, like all you have to do is put a little orthotic. It's really a lot more complex than that, is it not? Isn't there not special equipment that...
Right, yes. And let me make another point. You can't practice TMJ therapy if you don't have the right equipment. One of the things that says...
But you can practice TMJ therapy if you just happen to be a dentist. It's not
that's correct.
Recognized specialty.
That's correct.
Any dentist can say they're...
Any dentist can treat TMJ.
But to treat it correctly...
You have to have the proper equipment. And if you'll show here, here's a CMT, where we take x-rays of the TMJ joint and the neck and the shoulders and all this. There's only 3 of these in Arkansas. We're one of the only 3 in Arkansas, and I have one of them. And then the joint...
So would it be, if I was looking for a doctor to treat TMJ, would it be good to find out if he had this machine
If he
before?
doesn't have that, he's, kind of guessing.
Kind of guessing.
Yeah. This is a joint vibration analysis, which is a sensor that we place right over the TMJ joint and have the patient go through ranges of motion, have them move the jaw, and it picks up and senses vibration in the joint, which is disc movement. And based on and this is a software, of course, and this tells me what type of, where you are in that stage of degeneration that we showed in the earlier clip. So if you have the right equipment, you can make a proper diagnosis. Diagnosis is everything. You must diagnose correctly to treat correctly.
But it seems that all these people have been to, and everybody I talked to in your office that day, have been to multiple doctors. They've been to all kinds of different neurologists, and they all seem to think they're at the end of their rope. And when they get to you, nobody believes that you can fix it that way. Do you hear that all the time?
I do hear that all the time. And of course, that's one of the frustrations I have as a practitioner in TMD, is that people don't know to come to the dentist. They have headaches. Where do you go? You go to a neurosurgeon.
Right.
You go to your general physician, or you go to ENT.
And most of them aren't well versed in it.
That's correct.
Little schooling.
Yeah.
All right, we have to take another quick break. When we come back, I want to do one more interview, and then I definitely want to talk to you a little bit about sleeping disorders, including sleep apnea. Right. You're watching Medical News Network. I'm Mike Wittgenstein. We're in studio with Dr. Jolley, and we'll be right back.
Tarzan, Lord of the Jungle, King of the Apes, Father of Boy. He knows what it takes to be a dad. You go for a ride. You take a swim. You hang out. All it takes is time. Hey, it doesn't take a hero, but it takes a man to be a dad.
This is the hand that sows the seed, that grows the forest, that that gives shape to the wind, that carries the kite, that is flown by the child, that is loved by the woman, that gives to EarthShare, that supports the hand.
EarthShare is the workplace giving program bringing the leading environmental groups together. Support EarthShare, support them all. To learn more, please visit our website.
Mr. and Mrs. Jones, Sally's having some behavioral problems.
I guess that reward system isn't working.
Well, the timeouts weren't either.
You know, parents do find that timeouts aren't...
See?
Well, you're just too lenient.
Well, you're too strict.
No, you are.
Oh, you are.
No, you are.
No, you are.
When adults don't have the answers, they can feel as frustrated as kids. ConnectForKids.org has thousands of resources for helping kids in your community. ConnectForKids.org, guidance for grown-ups.
Welcome back. We're in studio with Dr. Roy Jolley, a nationally recognized leader in the treatment of TMJ and sleep disorders. All right, Dr. Jolley, I interviewed a lot of people that day in your office, and I mean, every one of them had a different story, but I have just time to get one more clip in. I want to watch this girl, and I want to mention to everybody that you have not seen these clips before, and we're getting a first-time reaction from you. So let's watch this girl and see what you have to say about this.
January 22nd, 2001, I was in a very bad car accident, had a lot of head trauma, and 6 months after that started experiencing a lot of head, neck, shoulder pain, like the back of my neck is what really hurt. Oh, I've seen at least 15 doctors, all different types of doctors, pain management, acupuncture, neurosurgeons, orthopedic doctors, chiropractors, regular doctors, anybody and everybody that I could talk to. And they all gave me the same answer. There's not a whole lot they could do for me. I was told I'd probably need surgery later on, because I was so tight in my neck and my shoulders that it was foreseeable that I would need to have a discectomy in my neck from living that way. So that's when I made an appointment, and actually I almost didn't come because, you know, I thought, you know, what good is going to, I don't know, I just almost didn't come to my TMJ appointment, I just didn't. But I finally made the appointment, and I came, and Dr. Jolley confirmed that I did have a TMJ issue that needed to be corrected. And so it didn't take long before I was in an orthotic, and I can remember 2 weeks after my treatment had started, walking out of this office, calling them up going, oh my gosh, my shoulders fell, and I can move, and my neck isn't all, you know, stuck in one spot, and I mean, it was awesome. I never associated the neck and the shoulder pain with TMJ. I just was tired of my jaw aching. That's why I came to Dr. Jolley. It was, you know, unbelievable to me that he could actually take care of my neck and my shoulder pain while taking care of my mouth and my pain in my jaw. To completely be out of pain when you've lived in it for almost 6 years now is nothing but a miracle. I am on no pain medication now, which is awesome. Oh, I love Dr. Jolley. I really think that it is a blessing from God that I was sent. I know there are a lot of people who don't think that the TMJ treatment can help them like it did me. I've had a lot of people asking me when I tell them about it, and they see that, you know, I'm not on pain pills, and that I'm actually able to feel good. They ask me that all the time. Does that really work? And I'm like, yes, I know, it's hard to believe, but true, it does work, it's awesome.
Now, Mike, you know why I do what I do.
Well, I want to tell you that that girl alone had seen 15 doctors, neurologists. She'd even seen other dentists that treat TMJ.
Most do.
What is it that really makes you any different?
Mike, I have over 800 hours of continuing education in the last 3 years studying TMJ and sleep apnea. I have equipment that no one else in Arkansas has. Very few dentists do. That's what, I'm not smarter, but that's what separates me from the typical dentist.
All right, I want to talk to you briefly about, and I may have to have you back to discuss it further, but sleep apnea, sleeping disorders. What are some of the signs or symptoms of sleep apnea or sleep disorders?
Mike, 19 million Americans have sleep apnea and don't know it. The most observable symptom is snoring. but also waking up in the morning not feeling refreshed. Remember, it's not how many hours you sleep, it's of what depth you sleep. So we have to get into REM sleep. But feeling tired all day, run down, you look in the mirror and you look old, there's bags under your eyes and you think, I've got aches and pains everywhere.
Falling asleep at the
falling
movies?
asleep at the movies. And you stop at a stoplight and you feel sleepy when you come home at the end of the day. You've got to take a nap. Those are some of the most common. Just a tired, worn out feeling all the time. Morning headaches is another symptom.
It's my understanding, if I go to a medical doctor, which most people would go to, for a sleeping disorder, and I'm sent to a hospital for a sleep study, I go spend the night in the hospital, they wire me up. If they determine I have any kind of problem at all, this is what I end up with, a CPAP, a machine that constantly blows air down my throat. Right. I mean, it looks very uncomfortable. It can't be comfortable.
Can you imagine trying to sleep in that?
Can you imagine trying to roll over and give your wife a kiss goodnight, or your husband a kiss goodnight?
How sexy is that? Yeah.
Exactly. Tell me about what dentistry is doing.
Dentistry has just come out with some new oral appliances that advance the mandible. When you give someone CPR, the first thing you do, you move the jaw forward to open the airway. At night, the laryngeal muscles relax and the tongue falls back. Well, if you move the jaw forward, it moves the tongue forward, which opens the airway. And this is just a simple device that keeps the jaw forward, and it allows for
What percentage of sleep disorder, sleep apnea patients can have success? Because I know that studies show that after 1 year,
10%.
10% of people are wearing this,
10%.
which means the other 90% are getting no benefit. Right. What percentage of people can benefit from a simple oral appliance like
90%. 90% success rate. I can't remember. I've never had one not be able to wear this. Never had a patient that couldn't wear an oral appliance. It's just too easy. This is a no-brainer. I mean, this or that. You tell me.
Doc, I want to thank you for coming on the show. We are out of time. Have to go. I know that you have a lot of information on your website. I know we've covered a lot of topics today. I'm going to kind of put you on the spot a bit. First of all, if everybody could take one thing home from the show, remember one thing about sleep apnea or TMJ, what would you want it to be?
It's the great imposter. You may have headaches, neck pain, but it could be your TMJ, and you need to go to a dentist who has a proper equipment and proper education to treat it.
Okay. With that said, you have information on your website. If people have questions, concerns, anything at all, if they call your office, will you talk to them?
Absolutely.
Will you personally?
Personally talk to them.
Dr. Jolley, I want to thank you for coming on the show. You've been watching Medical News Network. For more information on this subject or any other, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.